Well, today, the federal government is announcing a new milestone in the Canadian dental care plan and how they are looking at growing the program. Health Minister Mark Holland, live here this morning to talk more about this. Minister, appreciate you joining us here. Thanks for being here this morning on Halloween, talking about dental care. Kind of an appropriate day, I think, to roll out dental care packages. But what is the latest? How is the program changing now?
Well, imagine in just 6 months, 1 million people. This blows away our greatest hopes. And this is 1 million people connected to care. These are people who didn't have access to care. Many of the people we're talking to hadn't been able to see an oral health professional in years or decades. You know, you have seniors 20, 30, 40 years without a pair of dentures that are working in their mouth, now being able to have a smile they're proud of. And it's not just that that's social justice, it's just incredible that those people have smiles. It is connecting them to prevention. And if you think about what does that mean, 1 million people, it's such a big number. Imagine that you'd have to fill the Scotiabank Arena 53 times in order to equal the number of people in this country now have been connected to that care.
Pretty significant indeed, and we all know that dental health is very much connected to your overall health, so if we can get some prevention in there, that is key. This program being rolled out, it's really, I've found the evolution of this really interesting, because this was really effectively an NDP proposal brought together as part of the confidence supply agreement, but the Liberal Party really seems to have leapt onto it and maybe taken it even perhaps further than the New Democrats felt. What became so important about this to the Liberal Party here?
Sure. Well, I was the House leader at the time. We were having discussions and we were looking at an agreement with the NDP and we were looking for shared priorities. And one of those shared priorities was prevention and certainly oral health. And as you mentioned, and I'll just pick one dental clinic, I was talking to Dr. Redmond, 3 cases of oral cancer found on Canadian dental care patients just in the last number of months. These are folks who would have had that cancer develop into something much more serious, who were caught early. So yeah, we really agreed with this. And of course, then there's the hard work of rolling it out. And you remember, you know, when we were first dealing with this, people said, no dentists are going to sign up. The Conservative says it doesn't exist. So we did the hard work of now being at 88%, actually 89% of oral health professionals, 22,300 oral health professionals providing service. And now, tomorrow, we're looking at pre-authorization, going after those more complicated cases. And this is going to be huge because it means that right now, almost $2 billion a year in ER visits, that's what it's costing us for dental problems in ER rooms that frankly don't belong there. If we're doing our job on prevention, it's not only that it's going to save on average $730 for the average person using this, it's also going to save our health system a boatload of money. And we have to change our health system. We have to be upstream. We need to do Pharmacare. We need to do school food. We need to be doing what we're doing on health data. We need to be doing primary care reform. So all of these things work together, and dental is a really big part of it.
Okay, let's also talk, I mean, you're here, you're a minister in Justin Trudeau's cabinet. We've been watching very closely the comings and goings of what's been happening on Parliament Hill lately. A couple of confidence votes that you've survived, but now we're hearing Yves-François Blanchet wants to work against your party, sort of try to bring the government down, internal rumblings about what's happening within the Liberal caucus. I'm really curious about the sort of vibe amongst your party on Parliament Hill right now with kind of threats coming towards the Prime Minister from multiple sides.
Yeah, I mean, that's, you know, you get into an election year and in one way or the other, whether or not it's next October or sooner, there will be an election in the next year. And things amplify. But you know, look, the people that I talk to want me to be focused on getting things done. And there's too much politics going on up there. And I don't think that's what people are interested in. People going about their lives, trying to deal with, we're in a crazy world right now with all kinds of problems. They want to know how you're making it better. And dental care is all about that. Pharmacare is all about that. And that's one of the things that I'm going to do next. The fact that we could, in 6 months, get 1 million people seen and get 89% of oral health professionals participating shows you what we can do when we apply our minds to healthcare and work together. I think that all parties should be pulling in the same direction. Look, there's going to be an election, but really, well, in between it, we're not supposed to be, you know, at each other's throats and playing all these political games. We're supposed to be getting things done for people. As health minister, that's what I wake up to do every morning.
So on Pharmacare, do you think you can get something done in this Parliament as it exists right now?
Absolutely. Look, so we passed on October 10th, we passed through the Senate the Pharmacare bill. We're now ready to sign deals with provinces and territories. So that takes a little bit of time because obviously we have to respect the House process and the Senate. But we're ready now to sign those deals. I'm having active conversations with all provinces and territories. And what is that going to mean? That's going to mean diabetes medication for a patient who needs it. You know, we spend $30 billion a year on diabetes in this country, and it's going up every year. And it is bananas, like straight up bananas, that we're not making sure that people have their medication, because it stops them from getting really sick and costing us way more money. It stops somebody from getting a limb amputated, or stops somebody from developing a much more serious disease. Contraception is the same thing. You know, in BC, they rolled out universal contraception, same as we're going to do for the whole country. It's already saving them more money than it costs. So prevention makes sense, and we need to work with provinces and territories and all be pulling in the same direction. And frankly, that's the kind of thing Parliament should be focusing on, not politics.
Okay, well, it's interesting times indeed, and more on the dental care plan rolled out today. Minister, appreciate the time. Thanks for being here.
Thanks so much.